You've been on the ATP tour. You now also work with celebrities in other fields.
Right.
What's the difference?
They need to trust you firstly.
How do your celebrities manage recovery? Hello everyone and welcome to the Recovery Room. This is a very, very exciting episode because I'm thoroughly excited to speak to one of the first physios I worked with in India, someone who's a very, very dear friend, Gaurang Shukla. Gaurang, welcome.
Thank you, Shayamal. Thanks.
I know this is new for you.
It's completely new. It's the first time I'm ever doing this.
First time you're ever doing this. Don't worry. The reason I was very excited about doing this is I'm trying to create content to help physios and surgeons and practitioners get closer together.
Sure.
I'm trying to get them to understand the nuance of this practice and what it takes to really perform at the highest level.
Right.
When we started Heal many, many years ago, the industry was very nascent. There were very few people doing what we did. It was a long, hard journey. You were the first person that worked with me.
Yeah, literally the first
I
person.
was a very, very tough boss. What was that like? Do you still remember those days?
Yeah, I still remember it. It's like, obviously there was no learning. I learned under Heath when you told me first. And then once everything was done and he used to call me home just to get my hands a lot more stronger. So he used to call in all your friends. I think there was one day where I think I must have probably even abused you, saying you call like 8 people back to back and it's like 8 hours of work straight just for your friends. But trust me, it really worked, and it's like a learning process.
It is a learning process, and I think that's one of the main things that people don't understand, that the skill of physiotherapy really and truly requires your hands to really become your brains in some shape and form, and it takes that amount of time, an hour, to understand the body. And one of the reasons I kept doing that is because my core philosophy has always been, I cannot heal the body has to allow me to heal it. Right. So you have to be patient and you have to be gentle.
Yeah.
And with time, it will open up and allow you to do what you need to. That's been my core philosophy. And I don't know if I ever said that, but that was the reason we did what we did.
No, it's so true what you're saying. But it's till date, I can still, like anybody who's working under me, I will yet tell them, just go and practice hands on. That's the main thing. It's not about modalities. It's nothing. It's just about feeling the body. That's what I think. That's what takes you further.
Amazing. I was keen to have this chat because every time physios come up to me, the first thing they're looking for is they want to work with elite sports teams. They don't even want to start at the under 11 or under 12. They want to get an IPL team or the national team, or they want to travel with massive celebrities.
Right.
And I don't think they understand everything that's required over and above your skill. Your skill is just non-negotiable. You have to be competent. Right. But there's so much else that's required on an emotional level, on a trust level, on a commitment level, which nobody understands. You have made this transition very, very successfully.
Yes.
Do you want to deconstruct for them, what is actually required to make this transition from just running a basic clinic practice to working with high achievers at that level? What are the demands on you every day?
It's really tough. Firstly, it's not that easy to transit because be it an athlete, be it a celebrity, be it any HNI, they need to trust you firstly. Sport as such, like if there's a goof up on my end, the player, he won't be able to go and perform as well as it's supposed to. So I think gaining the person's trust is the first thing for me.
Yeah.
Also working a lot prior. Again, as I said, practice, going out. And then I think for me, it's always been like word of mouth. It's not been like so many people who I see, but it's like if one person really likes my work, they're going to recommend me to somebody else.
Yeah.
That's how you probably climb up the ladder. That's what's happened to me. And I think till date, it still works like that. That's why I only freelance or I'm traveling most of the time.
Yeah.
I don't think most people know me, but it's just that niche market which I see is what I'm going to do.
Yeah, I think everyone knows who you are. They've heard of you. They've probably not seen you or
They've
met
not
you,
seen you.
but they've definitely heard who you are for sure, and they know the work that you're doing. At what point did you actually realize that to work with a high achiever, it goes beyond your technical skills? When did you learn that and realize that?
I think when I was on the ATP circuit, I started off with Mahesh first.
Yeah.
And then I went on to Rohan. So when I was with Rohan, actually, I learned a lot from him because I was the only one with him.
Yeah.
So starting with training, his warm-ups, sometimes it was even the food.
Yeah.
Like I was literally doing stuff with him, for him.
Yeah.
He's helped me a lot in my entire journey. Also when in 2017, when he won his first mixed doubles Grand Slam.
Yeah.
That was a huge thing. Like, then that's when I realized, like what potential like a support staff, like a physio or a massage therapist or something would have in his life.
Yeah.
Is like, even when he said it, like I was in the stands and he spoke about me saying that, he's given me a huge congratulations that, it's because of him that, also I've reached this place.
Yeah.
That's like really heartfelt for me. It's like really, I mean, that gives me a lot of motivation to even do better.
Yeah, 100%. I mean, Rohan he's an incredible athlete. And, for those who don't know him, when you watch Rohan play tennis, he's big,
He's big.
He's massive. So, flexibility, he's not the most flexible person. There are a lot of demands in tennis, but having a physique and a structure like him, the demands are even greater. So the fact that he's performing at that level so consistently is testimony to his hard work and that support system that's getting him going every single day.
Right.
So when he says thank you, I know it's heartfelt because he feels it every day. You got to literally get that body going, get it moving. So you've spanned both sides right now. You've been on the ATP tour. You now also work with celebrities in other fields.
Right.
What's the difference?
I mean, the work ethics are different.
Yeah.
I think both are goal oriented, but both the goals are completely different.
Okay.
Like I say, like probably a celebrity would need to do more stunts or show his physique in a certain manner.
Yeah.
So that's their goal.
Yeah.
The athlete has to perform for winning. So that's their goal.
Yeah.
So I think the goal orientation is different.
Correct.
But both their mindsets are really clear. They're really strong on what they need to do or look like physically, mentally. They're all there most of the time.
Let's double click on the mindset of a high achiever and how they push you to get better. Can you expand on that a little bit?
I've worked a lot with tennis players.
Yes.
So even on the day of the match, they have to go and perform no matter what.
Yeah.
Like, because the beds change, the hotels change, the beds change, pillows change.
Correct.
There was like one morning I know with Rohan where he woke up with like a stiff neck.
Yeah.
But he had to go, his like first match at 9 a.m. So, but you can't just say that, okay, I'm not going to play and I'm going to quit, but I can't move. So then that's where that mindset comes, is that you have to do something or the other, make my neck a little more freer. I'll go and do my job.
Yeah.
Pre and post is mine.
Yeah.
So that's the mindset. You have to go and, at least for him, I know like he wants to win everything. It's the same with even celebrities. Like I know so many people who are doing like stunts, they're doing dance, they're doing everything.
Yeah.
There is a prep which goes in before, saying that I need to be this flexible, I need to do this, I need to do that. And post, because they're doing that for like 8 hours in a row, they need something post. So the mindset itself is, I think they're just like, they call achievers because they've achieved something. You can't just start off from scratch. It has to be inbuilt. You have to start off with that. You have to be that from a young age.
I think what you're talking about has served me extremely well, because when you work with them, you don't have the luxury of time. There's a deadline, and you got to hit it. You can't miss the target.
You can't miss the target.
You can't, so you are using all of the tools in your toolkit. You're doing whatever it can, because the goal is, the deadline is this and it starts. So when you go in with that mindset, it's very different from a clinical approach where you can say, hey, come in for another session, do this,
So true.
There's, that has like served me exceptionally well. And I think it was we brought that mindset into heel earlier on as well, where we didn't want to see people as often.
I still tell people, I said, like, if you're okay in 2 sessions, you don't take a 10-session package.
Yeah, exactly.
I don't know why people do it these days.
Exactly.
But, so it's my mindset even now. It's fine.
So how do you personally manage, the pressure of somebody's performance? Do you feel it? What needs to happen? How do you look after yourself in all of this ecosystem as well?
I think the more calmer you are, the better it is for you.
Yeah.
Because I'm sure that anxiety sets in even for the player, even at the highest level.
Yeah.
Like if you have a match point, I'm sure your serve gets tight. There's something or the other happening, there's a chance of a double fall. There's something like that. Same with celebrities. Like if there's something and, it doesn't look right on camera, then you need to be a little more calmer.
Mindful.
You need to know how to tackle it. It doesn't mean like if I'm assigned as a physio for somebody, I need to do, okay, I need you to, leave everything and just be with me. I'll take care of it.
Yeah.
It can't be that. It's like a whole support system.
Yeah, there's a whole system that's integrated.
That's integrated. That's the entire system which works in to make that person better or look as such on screen.
So, what would be your advice to clinicians right now who perhaps starting their practice but aspiring to work with a celebrity or aspiring to travel with a professional athlete? What does the journey look like and what should they be focusing on?
See, I think the skill set everybody has.
Okay.
It's more about your mindset or your approach towards that individual person.
Okay.
Be it a player, be it a celebrity. Yeah, I think you just need to be a part of their life, their ecosystem, because you just work as a team, ultimately.
So, a lot of people aspire for this because they think it's very glamorous. Perhaps
it is glamorous, but it's an extremely tough life.
So, you want to expand on the commitments outside what they perceive as glamorous,
I'll give you my example. Like when I used to travel on the tennis circuit,
yeah,
people used to tell me, you're seeing country after country, you're staying in swanky hotels.
Yeah.
I said, but my life is only from airport to hotel to court, and that's the triangle I follow.
Yeah.
And if the person loses, I'm back.
Correct.
That's the only thing. It's not that I'm sightseeing or I'm having fun.
Yeah.
And because I'm the only one responsible, there's no timeline for me.
Yeah.
I can get a call at 2 a.m. I can get a call at whatever time.
Yeah.
But I have to be present. It looks glamorous from the outside. On the back, it's not that much.
I think you had a beautiful journey because, you worked in a clinic, then you went into a high performance environment, but you went into a high performance environment where you were solely accountable for everything on the tennis tour. There was no second person. So nutrition, physiology, recovery, rehab in the gym, everything, the buck stopped with you, right?
Yes.
And you learned accountability, you learned responsibility, and then you moved into an ecosystem where it was a multidisciplinary approach with different experts in a team, each one doing their own thing, and you supporting and helping each other.
Yes.
I think if you went the other way, it would have been exceptionally hard. If you started off in a multidisciplinary team, only having to do what you needed,
what I needed,
and not even being aware of everything else, and then get thrown into this where,
no, I completely agree with you. But I mean, you have to be thrown under the bus.
Yeah.
I clearly remember because I used to be so, I couldn't talk to people. I remember you took me to Infosys once. And you said, no, it's just a drive because it's my lecture.
Yeah.
And you went on stage and you said that Gaurang's going to come and give you the whole talk. So it was like the 30 minutes of it's just me on stage and you didn't do anything.
Yeah.
So I think that's what also got me a lot more confidence as to whatever it is.
I mean, it's probably not a good thing, but I have this tendency of just, throwing people in the deep end because, and not any time, after a while, I understand what's needed. And I realize that, you just gotta just throw them in and they'll have the skills to figure it out. And even if you don't figure it out at that moment, it's not critical, but the experience is invaluable.
Completely.
So this is fundamentally important. I see a lot of physios and a lot of practitioners right now that try to just acquire certificates, in different training methodologies, right?
True.
You've also done a hell of a lot. Realistically, of everything that you've done, the breadth of your qualifications that you've done, how much of it do you actually use on a day-to-day basis when you're working with these people?
Not much, actually.
Okay.
It's just your skill set, maybe the diagnosis, which you need to be right with.
Okay.
Skill set everybody can acquire.
Yeah.
But it does take a lot of time to do the right thing in the right manner.
Yeah.
Just to make the person feel a lot more better.
Yeah.
I mean, I know so many people who don't want to use hands or don't want to do manual stuff.
Okay.
They'll put in like a needle, put a cup and leave, and then it takes you a lot more time.
Of course.
I can do the same, but if I don't need to do it, why do I have to stick a needle into it?
Yeah.
I mean, it does wonders, no doubt, but still.
So let's take a step back to what you've learned working with these different populations for the average person. What can they learn? Like, you've traveled with high achievers, you've seen celebrities, you've seen the levels of commitment, looking at everyone else, because you also treat other patients. What are the mistakes they're making? What are the things that others are doing at a highest level that these people should be doing to kind of take care of their body, look after the body?
Just set a goal, firstly, for me.
Okay.
Because the athlete has a goal. The celebs have a goal that this is this.
Yeah.
The athlete has to go out, win. But I think for a normal person, I don't know if they set a goal.
Yeah.
Recently, it's okay. It's all catching up. Everybody wants to get into fitness.
Yeah.
Somebody is signing up for a race. Somebody is doing high rocks. So that's their goal. So they're doing that.
Yeah.
But what about the other population who doesn't do anything?
Yeah.
So it can be anything, even if it's reducing a few kgs, a few inches. It's looking a certain manner.
Okay.
At least set a goal. Start working towards that. I think that would make a huge difference for even like the normal population.
How do your celebrities manage recovery? And what can the average person take away from that? What is the lowest hanging, highest impact recovery tool you think there is?
I think it's sleep.
Okay.
I'm sure athletes focus a lot more on sleep. They have like sleep trackers. They know, because I feel the body recovers when you rest.
Correct.
And if you don't sleep and if you're like completely anxious or you're sleeping for like 3-4 hours a day thinking about what's going to happen the next day or what's going to happen at work, I don't think it's a recovery tool. Then no matter how many ice baths you take or red light therapies you take or you take H boards, nothing's going to help you.
Okay.
I feel the body needs sleep. Think about the best thing to do is sleep. Athletes do a lot more there. It's like ice baths, there's physio, there's massage, there's obviously sleep, there's nutrition, there's everything.
Yeah.
But like even for the normal person, even if it's basic 6 to 8 hours of sleep, don't go overboard with anything.
Amazing.
It's just simple stuff.
So what would be your 1 or 2 tips to the average person who is, or how should they approach pain? If they're in pain, what's your advice to them?
So pain, I think, is very subjective. Most of the people have a sedentary lifestyle. So I think movement, firstly, is the main thing for them. Just some basic mobility drills, if they can do it, like it's like 5-10 minutes a day.
Okay.
Even if you don't want to work out, it's fine. Don't go to the gym, don't break your muscle.
Yeah.
But move in a certain pattern, so at least your day-to-day life gets a little more easier.
Yeah.
It's simple stuff, like even if you're doing like sky angels, you're doing like an inchworm, you're doing 90 hip rotations, you're doing stuff like that, extremely basic stuff. At least keeps your body mobile to a certain level.
Okay.
And just moving around in general, like go for a walk, go up like a few stairs.
What's the one most common injury you're seeing, or one biggest myth that needs to be broken with respect to how we should train? Because you're seeing it in injuries.
I think if you're not meant for it, don't try any exercise which is unstable.
Okay.
I see a lot of people doing squats on the Bosu ball in my gym, things like that, or even lunging through the Bosu ball. But if your joint is unstable or you're not mobile enough, you're prone for injuries. Just don't look at somebody else and go for it, because what athletes or professional person who's like been training for a long time is completely different compared to what a normal person is.
Yeah.
So just don't look at somebody else and go in for a workout.
everyone, Gaurang, thank you so much for chatting to me.
No, thank you so much.
It
Amal.
was
Thank you.
brilliant. I think
Thank you so
your
much.
insights are going to help the community for sure, because most people are aspiring to get to where you are. And I think giving them some background of what is required and the soft skills that are needed that complement your basic technical skills. An understanding of this is fundamentally important. And more importantly, I think people should know what they're getting into, be informed. I have to say, I don't think you knew what you were getting into when I put you on a plane.
I completely didn't know what I was doing.
But some people, through this podcast, through this chat, can be perhaps make a more informed decision. Thank you so much for chatting to me.
Thank you so much. Amal. Thank you for having me.
Brilliant.
Thank you.